Two of the most common diseases that we deal with here at Cardiac Arrhythmia Service is sudden cardiac death and atrial fibrillation. We do know that patients with weak hearts are at a higher risk of dying prematurely or suddenly, called sudden cardiac death. With the advent of implantable defibrillators, this is now preventable. Unfortunately, only about half of patients who meet criteria and would benefit from an implantable defibrillator actually have an implantable defibrillator. The main reason why this is the case is that patients were never told about an implantable defibrillator. It may never have been discussed. So I urge you, or if anybody you know has a weak heart, please discuss with your doctor, your cardiologist, or come see us at Cardiac Arrhythmia Service so we can discuss the potential for an implantable defibrillator. Another prevalent disease that we deal with is atrial fibrillation. It affects over 6 million people in the United States, and as modern medicine and technology improves, patients are living longer. As you grow older, your heart does as well, increasing your risk of developing atrial fibrillation. Atrial fibrillation is associated with a higher risk of stroke, so it's critical to identify anybody who may have atrial fibrillation so that we can treat and potentially prevent a stroke. Unfortunately, atrial fibrillation presents in a variety of different ways, and because of that, there are often people walking around with atrial fibrillation that don't even know it. Patients can have no symptoms, minimal symptoms, or different symptoms that they do not recognize as being atrial fibrillation. For that reason, if you or anybody you know has any symptom, anything that they feel that just does not seem right, please discuss this with your doctor, see a cardiologist, or come see us so we can make sure that it is not from atrial fibrillation.